This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
Well, by the time this next segment is finished, a couple more people will have received the devastating news. You see, every 2.5 minutes, someone else is diagnosed with lung cancer.
Wait just 30 seconds more and a lung cancer patient will lose their battle. That makes lung cancer, according to the Lung Cancer Foundation of America, the leading cause of cancer deaths in the U.S. It accounts for 29% of all cancer deaths. To put that into perspective, lung cancer claims more lives than breast, prostate, colon, liver, kidney, and melanoma cancers combined.
More than 221,000 new cases will be detected this year, making up about 13% of all cancer diagnoses. The thing about lung cancer is it's one of the most difficult cancers to treat. It's also often difficult to detect in the early stages, and it can take years to develop. But there's a lot being done to better those numbers.
As a matter of fact, Peninsula Regional Medical Center is participating in lung cancer clinical trials, which, according to the hospital, test new treatments in people with cancer. Right now, there are 9 open trials the hospital can get qualified lung cancer patients into if they want to participate. The RMC is working with Johns Hopkins Clinical Research Network, as well as the National Institutes of Health and other institutions. Now, awareness is also important.
Absolutely, especially when you consider recent survey results that showed many people aren't aware that lung cancer is also the #1 cancer killer. There are efforts underway to get the word out about lung cancer, and joining us today to tell us more is lung cancer survivor and advocate Dina Cook. Dina, thank you so much for joining us today.
Oh, thank you for having me.
Okay, so first thing, you know, unfortunately, when people hear lung cancer, the first thing that comes to mind is smoking. And you actually take offense to that, don't you?
I do, because it is the first thing that someone will ask you when they find out that you've had a diagnosis of lung cancer. And that's part of the stigma that I think is impeding research and also well-being for the patient. You don't need disgrace along with a diagnosis of lung cancer. And there are 20% of all new diagnosis of lung cancer patients that have never smoked at all. 60% are former smokers. We need to change the way that people think about lung cancer, and we need to end the stigma and stop asking that question.
Yeah.
And as a matter of fact, you even gave us bands that say, end the stigma.
Yes.
Wow. So tell us your story. When were you first diagnosed?
My initial diagnosis was in July of 2012. The process started in the fall of 2011. I had developed a nagging cough, kind of like, well, I get it every fall,
right.
Basically from allergies. Was keeping my husband up at night, so I went to the doctor to get some medication, and my prudent primary care doctor ordered a chest x-ray just to make sure I didn't have pneumonia, which showed something, but I didn't fit the profile for a lung cancer patient.
Right.
They thought maybe I had a virus or I had been somewhere that had a fungus. They did a bronchoscopy, that came out negative. We're kind of just following it. Eventually in July, things had progressed, changed, and a surgeon decided that it needed to come out no matter what it was, and it did turn out to be lung cancer. They removed my lower left lobe. I woke up from surgery with that diagnosis.
Really?
Yes.
So you weren't even thinking cancer when you had the cough?
Yes, I wasn't thinking when I had the cough at all.
Yeah.
And it went away.
Yeah.
You know, the good drugs, the cough medicines made it go away. Mm-hmm. But it was the follow-up months that we knew something was wrong, but wasn't really that concerned that it was lung cancer. The second time I was diagnosed, which was at my 6-month CT, I had another primary lung cancer tumor in my upper left lobe, and later had that portion removed as well. So I'm a little lung challenged on the left side.
Oh.
So how has the diagnosis changed your life?
It has made me realize how precious life is.
Yeah.
Once the second tumor came around, I really started to research lung cancer, and I was amazed at the lack of awareness, the lack of funding by our government for the #1 cancer killer, the stigma that surrounds it, and the number of young people that I eventually met that are being diagnosed, that are my children's age, that are being diagnosed with lung cancer, that are runners, that are healthy, vital people, and the cancer's not being diagnosed initially because the doctors don't look for it in this group. They're being diagnosed at stage 4.
Yeah.
And we need to change the whole conversation.
And there's screening that a lot of people don't even know about for lung cancer.
Yeah. There's recent screening that was approved in 2014 for the general public that has health insurance, and it is a health coverage. There is a high-risk group, so you have to determine what if you fit within that group. But,
and it's low-dose CT,
right.
and that's the requirements right there on the screen, right?
Yes, yes. And the basis behind it is there's no copay and there's no deductible. So it's like getting a mammogram. So if you fall within that, high-risk group, please go to your doctor and find out if you can, if you qualify for it.
And that's where your entire Shine a Light on Lung Cancer event comes in.
Yes.
Tell us about that real quick.
I'm very excited to be working with the Lung Cancer Alliance again this year, which the Lung Cancer Alliance is the #1 lung cancer advocacy group, I can't pronounce that word, in the country. Along with PRMC, we are going to be at the center in Salisbury, right by Boscov's. We've got the Pop Warner.
November 5th, 6 o'clock.
Right, November 5th, 6 o'clock.
Looks like a good time.
Yes, it will be. And we've got cheerleaders, we have speakers, and we'll have information. So people that have lung cancer, please come out, join us. If you've lost someone to lung cancer, come out, honor them. And if you need information because you're concerned that you might be at risk, there will be people that you can talk to.
Dina, thank you so much. And as always, if you want to read more about lung cancer or you need more information on the Shine a Light event, go to WBOC.com, click on our picture at the top of the page. From one story of survival and perseverance to another, people work through challenges and tragedies in many different ways. Up next, meet a woman who went from her lowest of lows to her highest of highs. Hear how she was able to overcome.
And a little later on, we're talking about quality versus quantity of sleep, and which has a greater impact on your mood.
But first, we just learned about lung cancer. Dr. Oz says another area of your body you want to pay close attention to, your thyroid.
Hi, I'm Dr. Oz. It's time to consider your thyroid. This small organ plays a big role in metabolism. When it's not working properly, it can lead to weight gain, fatigue, even depression. Over 10% of us will develop thyroid conditions in our lifetimes, and women are at the greatest risk. Your doctor can diagnose thyroid issues with a simple test.